Good morning, ladies and gentlemen. You only see what you look for, and you only recognize what you know. Boyd, 1953. I want to open your eyes. I want to show you how with modern technology we can effectively fight prostate cancer. This is a major disease. Everybody knows the pink ribbon, but nobody recognizes the blue ribbon. Nonetheless, dear gentlemen, we are ahead of our female colleagues. They have breast cancer, but we have more prostate cancer. So more men will die of prostate cancer. In this audience, the first 5 rows, that's about 100 people, they will get diagnosed prostate cancer in their lives. Prostate cancer is diagnosed by taking a blood test, the PSA, prostate-specific antigen. If it's elevated, the problem starts because you're uncertain about the presence or absence of prostate cancer. You will get a finger of the urologist in your rectum, 12 needles as well, but only 1 out of 4 men has prostate cancer. Dear gentlemen, look at your neighbor, because it's either him or you who will get those 12 needles in his rectum. Are you still comfortable? If we don't do anything, that will happen to you. It's not a joke. Fortunately, we have a very nice tool to help that and to prevent that. I would like to introduce my friend John. John has an elevated PSA, so he will have the finger as well as the needles. Now, where's the prostate located? The prostate is in between the urinary bladder and the rectum. And the urologist sticks in his finger and shoots needles with ultrasound biopsy. But ultrasound doesn't see the tumor. There they are, the needles. 1, 2, 3, 4, 5. In total, 12. With MRI, we, however, can see the tumor. And with one shot, we hit the tumor. Boom! There it is. One shot only. The finger of the urologist and the needle doesn't have eyes, but we have MRIs. Thanks to a major grant of the Dutch Cancer Society, the Queen Wilhelmina Award, we have developed, validated and implemented the best MR technology possible. Imagine that patients from all over the world travel to the Radboud University MR Prostate Center of Excellence. Isn't it ridiculous that patients, even from Australia, come to us to have certainty about their presence or absence of prostate cancer? Can't we do anything about it? The answer is yes. I'm going to show you that we can bring MRI at your hometown, wherever you live, thanks to simple electronic communication. With this, we can build up a Center of Excellence network, multidisciplinary discussion from all over the world. And that is actually what I'm going to show to you. I now would like to zap on the podium Les Thompson, live from Brisbane, Australia.
Good morning, ladies and gentlemen.
Good morning, Les. Please introduce yourself and tell me, what is your problem?
I'm a urological surgeon from Brisbane, Australia. We have been using your MRI techniques now for about 2 months with great success.
That's very good, thanks.
It's wonderful to see how the MRI diagnosis improves patients' outcomes and patients' therapy. Until now, we have not been able to image the internal structure of the prostate.
Yeah, I know.
Using your protocols from Nijmegen, we've been producing excellent images. Because of this, diagnosis is less invasive, and we've been able to plan out our treatment more accurately. Jelle, can you help me with a case from Brisbane? This case is a 70-year-old man with a PSA of 10. He has no symptoms at all.
Yeah.
He's had 2 sets of truss biopsies.
That's
that is
too
24 biopsies in all, and all of these have been negative.
Doesn't surprise me.
Can you please help me with the MRI diagnosis?
Yes, of course, Les. Let's go to the face talk and let's look at the images together. So Les, thank you, you're back again. Now, please can you scroll through the images and tell me where the tumor is? You see, ladies and gentlemen? You see, ladies and
right in the front of the prostate.
You see, ladies and gentlemen, I'm not touching the mouse. It's actually Les in Australia who is controlling the computer. Now, Les, what problem do you have?
This man has a very nasty and aggressive tumour in the front of his prostate. Could you comment on the diagnosis, please?
Yes, actually this tumor has restricted diffusion. You can see it by the orange color. The tumor is located over here. The orange color means that this patient has a very aggressive tumor.
Good. Could you comment on the distribution, where the tumour is?
The tumor is very close located to the external sphincter. And actually, I think this is a very difficult case.
Good. Can you help me with the diagnosis, as well as the diagnosis? Can you help me with the treatment? Can you organise some other opinions?
Yes, of course. We can ask David Samadi. He's the top robotic surgeon in New York, to see what he thinks about this patient, whether he can treat this patient with robotic surgery. I'd like to call David Samadi now first on the 3D.
Hi, my name is Dr. David Samadi. I'm the Vice Chair of Urology here at Mount Sinai Medical Center in New York and the Chief of Robotic Surgery. It's a pleasure to be with you. Here at Mount Sinai, we have performed over 4,000 robotic prostatectomy for localized prostate cancer. Yeah. And with collaboration with Dr. Jelle Barentsz, we've been able to integrate the MRI images in order to locate the cancer and be able to do our smart technique surgery. Smart surgery is very unique compared to other robotic surgeries in a sense that instead of taking the nerves from the prostate, we have modified it so we're taking the prostate away from the nerves. And as a result, there is a major improvement in sexual function and urinary control. In the last 2,300 cases, there has been no transfusion. These surgeries takes about an hour to an hour and a half. They stay one night at the hospital and they end up going home the next day.
Thank you, David. This is a very difficult case, however, so I really would like to have your opinion. So, David, please appear on the screen and have a look at the images. Hi, David. How are you?
Hi, David. Good morning, Jelle. How are you?
You had to get up very early, didn't you?
It's fine. It's perfect to be part of this event. It's a pleasure to be here.
Okay. Well, David, please, can you give your opinion about this patient? You've seen the images already, and there is a tumor very close to the external sphincter, which is the muscle which controls the continence of the patient. So I'm a little bit afraid that if you do surgery that you will cut it and that the patient will be incontinent. What's your opinion?
Well, the location of this cancer is actually quite interesting because it's extremely difficult to get to. This cancer is right under the pubic bone, and obviously it's very close to the sphincter. And that allows us, instead of using our fingers or open surgery, now I can use the robotic technology along with your MRI to locate the cancer really well, be able to come in with the robotic technology way under the bone, and using the smart technique that we developed here, I can bring the prostate out of the harm's way and go beyond where the cancer is, without damaging the sphincter, be able to remove the cancer and not leave any cancer behind. Since there is no blood in the field, the robotic technology allows me to be able to see really well and make sure that we're not leaving any cancer behind. We are also equipped by the pathologist during the operation that in case there are any suspicious tissues, Jelle, I can get a frozen section and make sure we're not leaving any cancer behind. The MRI plays a big role here because it gives me the extension of the cancer exactly. So the combination of robotic technology and MRI plays a big role in curing this patient while we are not damaging his sphincter.
Information. What do you think about his information, Les?
David, it's an excellent technique you're using. I'm sure it'll be very successful. The sphincteric mechanism, however, is at risk. And I just wondered, Jelle, if there were any other opinions that you may be able to give me.
Yes, we have somebody in the room here, which is Emil van Lin, our radiation oncologist from our hospital. He is a top expert in the radiation of prostate cancer. Hey, hi Emil, how are you today?
Hello, Jelle. I happen to be around accidentally, and thank you for inviting me. Les, you gave us a very challenging case.
Emil, can you show to the camera what you see on your iPad, because that's your communication method? You see the image which I have here and which I can control on Emil's iPad. I can just put the cursor and put orange color off and on. So Emil actually is seeing what I'm doing here. Please continue, Emil.
As I said, this is a very difficult case, and several treatment options are available. So I think that we should inform the patient, make him a partner of our treatment options.
Emil, do you think this electronic communication by iPad will be helpful to the patient?
Absolutely, because everybody has an iPad, or at least some imaging modalities.
Or an Android.
Or Android, or whatever. Sorry, BlackBerry, Samsung, yes. But as I said, being a vital man, we should present the different treatment options. And of course, in Nijmegen, at our university, we do have weekly board reviews, tumor reviews.
Yeah.
Jelle is on board, literally, and he shows us the images. And we can, and also the patient...
So please concentrate, because the time is running. Please concentrate on your advice for this patient with radiotherapy, for Les.
First of all, spare the sphincter.
Okay.
And give a high dose to the tumor.
So is it possible to do radiation?
Absolutely, yes. In this case, it is.
Okay, Les. Les, are you happy with this?
Yes, that's very good.
Okay, I really would like to thank you all. Les, please now appear on your hologram again to say some final words. Thank you, Emil. Thank you, David.
I think it's great. I now know where this tumour is. I know how aggressive the tumour is. I've had top treatment advice. This is a fantastic way of communicating. Mm-hmm. I know what I'll tell the patient when I see him tomorrow morning. Thank you, Jelle, and goodbye.
Thank you, Les. I have a dream. I have a dream that all patients with a potential prostate cancer will have an MRI. Is that possible? Yes, we can. I try to impress you with holograms. That's fantastic, but that's only for show. I'm more excited about the face-to-face talk which you have seen, even in this audience, communicating and discussing patients between specialists. This will certainly implement the MR technology in a fast way. And that will improve patient care. A better diagnosis will result to individualized treatment. Decreased uncertainty of the patient, because the worst thing which can happen to a patient is uncertainty. You want to know whether you have a tumor. You want to know if your tumor is going to kill you. And if you have the tumor, you want to fight it. Thanks to this modern technology, it is possible. With e-communication, we can bring the MRI to the local radiologist at the patient's doorstep. So you're a radiologist somewhere in the north of Netherlands, or in the United States, or in South Africa, or even in Asia or Australia, will be able to see what we're doing. We can teach and implement this technology by using e-communication. You only see what you look for. The technology is there. We only have to look for it. You only recognize what you know. We know that with MRI and e-communication, we recognize that we can successfully fight prostate cancer. Why? Shooting. 12 arrows. To you. To you. To you. They hurt you. They hurt your prostate. We can't get a diagnosis. If we use the modern technology instead, we will just hit with one needle the apple in the most rotten place. Looks like Robin Hood, the MRI Robin Hood. So, dear gentlemen, you have a bright future ahead of you. Thanks to this technology, MRI and e-communication, it's not you or you who will have 12 needles in the rectum. No, it's only one of you on the first row who will have only one needle with a precise diagnosis. With this, I thank you for your attention.